Good evening and welcome to the Health, Social, Educational, and Environmental Committee meeting for September 5th, 2024. Let's rise for the Pledge of Allegiance, and Legislative Council, would you please lead us?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Roll call, please.
Legislator Crowley, Legislator Gouldman, Chairwoman Sage.
Present. And for the record, I have asked Legislator Adamizio to sit in this evening. Okay. Item number 3 on the agenda is acceptance of minutes for August 20th, 2024. Make a motion to approve.
Second.
All in favor?
Aye.
Agenda item number 4 is a discussion with the Social Services Commissioner, Sarah Cervidillo, about the mental health update here in Putnam County. Welcome.
Hello.
Hello, everybody.
It's good to see you.
You too.
So we spoke briefly last month. We know there's a lot of activity here in Putnam County regarding mental health and the status of mental health, and we thought it would be appropriate to come in and speak about this separately so that we can all have an idea of what's happening here in Putnam County and possibly all over the United States.
Yeah.
I think it's probably indicative of the times that we're in. I'll let you have the floor.
Sure. So we still have no further update on the stabilization center. It's still at the contract and lease with the landlord stage, so unfortunately I don't have anything to update you on that. We continue to have the weekly meetings though with the county executive's office and myself, so we had that meeting today. Our co-responder team, I know that myself and Captain Knox came here around April to talk to you guys about the CRT. Since then, we count our engagements as unduplicated. So we've worked with and engaged 415 people since the end of February. So we are, if you add in duplicated visits, which often there is, we're well over 1,000. So when we engage an individual, there's often anywhere from 1 to 10 follow-up visits with the person. So they're busy. We are receiving probably 4 to 6 new referrals a day. We are able to farm those referrals out to the dual recovery coordinator and to the coordinator of individuals with disabilities. So we are able to have some help in that regard. So we're busy. The Sheriff McConville and myself have started having conversations about expanding the co-responder team possibly to the other side of the county. We would love to see a CRT model in our full-time law enforcement agencies because the need is there. There's just so many people that need engaging and referrals that we can't keep up. So they are busy in the CRT.
Can we ask questions while we go on each topic?
Sure, go ahead. Legislator Montgomery.
When you say 415 people engaged since February, what are you engaging in? Like what are the calls? They're just mental health calls, suicide attempts, anything?
Anything that we would classify as a call for service regarding somebody in crisis. That could be substance use, mental health concerns. I think that a majority of them are for individuals that are dealing with substance use and mental illness, but we do get quite a few for.
And they're looking for you to
They're
find
not.
resource.
They're not looking. So we are.
You're finding them.
We're finding them. We're looking at the calls that are coming into 911,
Okay.
and we're working with the other law enforcement agencies to identify them. We reach out to them. Sometimes they don't want help, and that's fine. We're not pushing ourselves on them, but for, I would say 9 out of 10 people do want some sort of assistance, and that's how we're engaging them.
And when you say refer, so you're referring them to the co-recovery coordinator and disabilities, and But you're not, this isn't happening over on the west side of the county?
No, it does.
Okay.
Yeah, it
Is that
does.
something we're looking to?
We're looking at, if we were to expand, it would be great and ideal to have another co-responder team on that side of the county.
Okay.
That's what I'm saying, because, you know, when we look at, is it the east side? I asked, the east side of the county? And Sheriff McConville and I just spoke to the Phillipstown Hub about this. There's a lack of clinical services over there, which we're talking about and hopefully going to be addressing directly with the Hub and Cove Care, but
I've been on talking to Eric for 2 years now,
Yeah.
now that they're opening that new space. Hopefully it's gonna happen.
So Commissioner, can you take us through how a 911 call comes in? That's where most of these calls are coming through, and then that's dispatched to the co-response team, or how does that work?
Yeah, they're
How do you
not
get the calls?
directly, they're not directly dispatched yet. We're getting there. We are going to be providing mental health first aid training to all of our dispatch staff before the end of the calendar year, which is great. We haven't gotten to a direct referral system yet, but that is the goal. The CRT is searching for it, and they're finding them. So yes, dispatch will call them directly if they have a call come in. That's not 100% of the time though, and it's not expected to be yet. So we also get direct calls from the local law enforcement agencies.
So they call directly
To the
CRT
CRT.
team.
Yep, yeah, they've obviously met everyone and we've spent time with everybody when we first started the CRT, so.
And how many are on the CRT team?
Just two.
Just two?
Yeah.
That's what so this is a huge caseload for two CRT
Yep, it's just the
members.
Deputy Ward who came to
Yeah,
present,
yes.
and Katie is my staff.
Right. Wow, that's a huge caseload for two people.
So that's CRT.
Thank you.
You're welcome.
That's really great. Thank you.
On the crisis intervention training front, we did receive money from the state for CIT training. We are running Putnam County CIT class in 2 weeks. We're lucky because we're able to utilize Westchester and Dutchess County's academies for that as well. So it's often that our law enforcement officers will go down there. So there is currently a class right now in Westchester. So we have, I believe, 6 or 7 people from Putnam down in Westchester right now. So we are hopeful to receive that grant money again next year from the state. We are getting more mental health workers and sheriff's deputies trained to deliver this course. So next year we'll be able to run it all in-house and not have to bring in outside entities, which is good.
Yeah, that's great.
And later on, we will be talking about some money that we're going to be utilizing to help the sheriff's office with backfill and overtime for officers to attend CIT. I think that by the middle of 2025, across the county will be about 80% CIT trained, including Kent and Carmel PDs, which is great, and state troopers as well. So.
Legislator Anderson, yeah.
Yeah. How long does the training take?
It's a 40-hour, 5-day training.
40
It's a
hours.
big commitment. That's why it's, for smaller departments, it's difficult
Okay.
to send. So the very condensed version of CIT is mental health first aid. That's what we're going to be giving to the dispatch. We also will be providing it to EMS. You know, these are just, there's not that many of us that can do the training, so we're trying to get everything in. We have youth mental health first aid that Shannon and I, we got to do as well with their schools, so just a lot of training, which is great. We just need more people to do it. So, and that involves what's called a train the trainer. Train the trainers usually are 3-day commitments where you learn the curriculum to do the training.
Can I ask another question, just quickly? So, I'm over 415 engagements since February and 1,000 duplicated. Tell me how getting a stabilization center here would help alleviate that. Would that alleviate some of those? Or would that, I mean, obviously provide resources for those people who are brought to the stabilization center, but just wondering how that would interact.
I think that one thing that will be, it's hard to talk about the stabilization center because it's not reality and it's
Yeah,
not tangible
right.
for me right now. What is the mobile crisis team. We are at the very end of that, and we should be operational. Hopefully, they have to hire some staff in the fall,
Okay.
which is great. So that is a team, the mobile crisis team, that is being run by People USA, the
Yeah.
same organization
Yeah.
that will run the stabilization center. We see them working very closely with the co-responder team. The mobile crisis team is going to be a team of, it'll be a peer, a social worker, a case manager. It's like a mini treatment team. The goal being to hire a psychiatric nurse practitioner or a psychiatrist. It's very difficult to find one of them right now, but of course, that would be ideal. A big thing that we're seeing is the lack of psychiatry appointments and NP appointments. So oftentimes when somebody is prescribed psychiatric medication, there will be a gap and they have no medication. So those people are going to the emergency room to get the scripts, like a Bridger script filled. Ideally, the mobile crisis team would be able to step in that situation and get that person until their next appointment. The stabilization center is really a site that works best if you get there pre-crisis.
Right, okay, yeah.
And you're not in full-blown crisis when you go there.
Right.
The co-responder team really is engaging people when they're in crisis. So I don't know if it will change the numbers, but I do know that they will work very closely together.
Okay. Thank you. Did you have anything?
We continue to
Oh, go
see,
ahead.
I'm sorry.
No,
We
go ahead, go
continue-
ahead. I knew you were thinking. I was
We
thinking.
do have, this is not just a Putnam issue, it's an everywhere issue. The amount of time people are waiting for appointments, we continue to see that. We are doing our best to navigate that. We are starting to see positive results of our opiate settlement money, which is great. We still have some abatement money that we'll be able to supplement with, so in the next month or two, we will be gathering again to talk about next year's money with the opiate settlement money. So we have a lot of potential and we have a lot of funding, not only from that, but also from the state, which is great. I think it's good that Shauna is here because we do have, she's a big part of the creation of the opioid fatality review team. Some of you have been educated on the Bridge Alliance, some of you have come to our meetings. This was kind of born out of that, that committee, and I believe you did receive an invitation to our first meeting that we have, and we hope that you can come. So the opioid fatality review team is, it's a group of, it's a group of individuals not only directly involved with the system, but also loosely involved, and we really are identifying the gaps in service. We know they have them, but the biggest change with this group is that we're actually going to make change, and we're going to put things in place to help people. We have seen a dip in the overdose deaths this year, which is good, but we want to see all of our thoughts and ideas come to fruition, and that really is a big piece of the OFR team. We are on trend with last year's suicide numbers. I don't want to go into specific numbers because there are some of them that are still being not investigated, but oftentimes when somebody does die by suicide, there are substances involved, so
Yeah.
it's often many months before a determination is made. but we've had them. August was a difficult month. We had 3 suicides, completed suicides in Putnam County. So of our residents, I should say, the suicide prevention and postvention teams are reestablishing, and we are going to be pivoting a little bit, because the postvention needs to be stronger for obviously the family members that are left, but the suicide prevention as well. So hopefully we don't have any more for the rest of the year.
Yeah. I recall at, I forgot what meeting it was, but we had talked about suicide was going down in Putnam County, and we felt that that was attributable to the information and concentrating on, education and, I don't know.
Yeah, so part of the opiate settlement award money is a stigma campaign, and hopefully by the end of 24 it will be rolled out, but it is a lot of education between the health department and in my department. We really have gotten out there, and we are speaking and we are presenting, and people are talking about it, and Putnam has a long way to go to catch up with our surrounding counties, but we don't want people to feel bad about talking about how they feel anymore in this county.
Yeah.
So we have a long way to
Absolutely.
go. We'll get there.
Yeah. Absolutely, I think that has a lot to do with it. Speaking of mental health, you have a new hire to help with.
Yeah, so the mental health director will be onboarding in the next 4 to 5 weeks. So I will have more information on that the next time I come.
Okay. Hopefully by the end of the year.
Absolutely, yes, it will absolutely be by the end of the year.
Legislator Eldner.
Commissioner, I hope I'm wrong, but when we discussed that this time coming up into this season, the data shows that there's probably going to be an increase, particularly with the change in the amount of sunlight, shorter days, and an election. Is that still correct? We would expect an uptick?
Yeah, I think that the historical trends that we have seen don't apply anymore post-COVID. So I think that, yes, but it has consistently been
Until you're
at
home.
that level. We used to see the, our slow period would be the summer. We would see a dip in admissions, we would see a dip in crises because people are outside, they're happy, literally, it's nice out. We haven't seen that in 4 or 5 years. So everything is elevated, data is off the charts. I expect, quite honestly, it to be the same throughout the rest of the year. Yeah.
Legislator Nestorino.
Seems we have a lot of meetings about the stabilization center, and I just want to go on record to say that I hope that this comes to fruition. We've been talking about this for years, and I believe it's a crucial service here in Putnam County, and it is, like you said, for prevention and intervention before a crisis hits, and it especially impacts our youth. There's a big population of kids struggling, and they have to go to Westchester or they have to go to Dutchess, and it's been an ongoing problem for years. So I hope that really comes to fruition soon.
Me too.
Yeah.
Sarah, we've committed a lot of ARPA money to the stabilization center, correct?
Yes, 2.5 million.
2.5, that's what I remember. When do we, because that money has to be contracted by the end of by the end of the year. When do we pull the plug on it? Has there been any discussion on that? If we don't use it by the end of the year or commit to it, we could lose.
There have been discussions about that. I haven't been involved in them.
Okay,
So.
the administration.
Yeah.
Okay.
Yeah, I know.
I agree with Legislator Dasmarino. I mean, it's something that we've worked on for so long. I know it's hard to find a site
Yeah,
Um,
I will say that the county executive has fully committed to the project. He has stated that several times in meetings, not only with myself, but with people, and they are fully committed. So we are, unfortunately, it's out of the local government's hands right now because it is in the hands of people and with the landlord dealing with that. So we can't get involved at this point, unfortunately.
Thank you.
Are there any proactive, I mean, education is important. What other proactive steps can we take to help, like, just stave off some mental health crisis? I don't know, I feel like we're just like chasing, a crisis, just trying to keep our head above water, watching it happen. I mean, what are the proactive things that we could all be doing?
I'm very excited that the school-based mental health clinics are expanding. We are, Brewster, Carmel, Mayapack, and Putt Valley will have operational clinics in their districts
That's awesome.
within the next month or two, which is great. We would love to see that expanded to every school building in the county. A lot of Westchester and Dutchess counties are having multiple clinics within one school district, so that would be ideal. We have great organizations like the Prevention Council and Cove Care that are doing that work, and they're doing great work.
Mhm.
There's just not enough people to be doing it. So internally at the government unit, we are trying to expand. That's why we're expanding. We're able to do that. We're able to supplement the Prevention Council, Cove Care, People USA. It's a lot of work to do with a small amount of people. So we're trying to get creative. We're thinking outside of the box while trying to be fiscally responsible.
Yeah.
Is challenging, and we're trying to figure it out.
Yeah.
Yeah.
Legislator Montgomery.
So if the 2.5 million for the stabilization center is not allocated by, well, we already allocated it, but if it's not contracted by the end of the year, and you don't know what alternatives are being talked about, you're not involved in those conversations, I understand. I'm sure you might have ideas, and I don't want to put you on the spot, but just as you talk about the Prevention Council and Cove Care and like the mobile crisis team, I would like to go on record by saying, why don't we put some of that money, why don't we put all of that money, because it doesn't look like it's going to happen by the end of the year. It's September. I can't imagine we'll get through like a planning board and local Carmel Town Board or, Brewster or anywhere where we could have this. There's going to be a fight about putting a stabilization center in any town. It's not going to happen in 3 months. It's not going to happen. So can we take that 2.5 million and distribute it amongst the people that are really doing the work, like Cove Care, like the Prevention Council, like the Phillipstown Hub, like St. Christopher's Inn, like your department?
I think that there are crisis services that mirror a stabilization center that aren't brick and mortar, such as the mobile, it's literally a mobile trailer, a very large bus that has the mobile component to a stabilization center. So I strongly feel that we need that type of
Intervention, yeah.
intervention and setup in Putnam. Maybe we need to talk and pivot to a mobile platform so that we avoid the town approvals. But you need someone to come to you when you're in crisis, and
Yeah.
that's just best practice.
It's very hard to get someone in crisis to a stabilization center. That's been my experience, but also, like you said, you need someone to come to you,
Yeah.
and I think, like anything, we can mobilize a DMV, we could do this. I think it's more effective. Then stabilization center, I don't know if people understand, it's literally for 24 hours, and then they have to be sent somewhere.
Right.
And most of the time, they're sent home because there is nowhere to send them because there's not a bed available, or a therapist or a psychiatrist.
I think maybe you and I should spend a little bit more time talking about that
Yeah.
offline, because respectfully, I'm not going to agree with you on
Yeah.
it because I do believe in the stabilization center model. But let's spend some time,
Yeah.
even up at the Dutchess County one.
Sure, I mean, and
And we
that's the stabilization center that would serve
Yep.
my district anyway, so, you know, I'm not opposed
Which
to
we-
it being here, but I think we'd get more for our money with a mobile crisis unit.
So I think a stabilization center, as you pointed out, is not for people who are in crisis, people who are having a breakdown, but it's to try to intervene before they get to that point. To
Yeah,
give
and-
somebody access to something who might have
Any
a...
crisis service ideally would engage someone before they are in full-blown crisis. We don't want the individual to experience the trauma associated with that, especially about going to the emergency room. So all of, when we talk about crisis services in Putnam County, it's gonna involve mobile crisis, CRT, stabilization center, things that can avoid the person going to the emergency room unnecessarily. Obviously, people still are gonna need to go to the emergency room. Those people will still go. And I think that we need to take a look at what isn't working with the Dutchess Stabilization Center and make those changes locally here. Because I agree with you on some things that you said. That's not how I certainly want our stabilization center to run. So, and we don't want to see your side of the county have to go up to Dutchess. It's where we continue to talk to you about the transportation options within people to get individuals over wherever it will be. So,
Thank you.
all right, what else you got?
Any other questions? Any-
Good?
Anything that you didn't cover that you felt like you wanted to?
Thank you. It
Had
was
a
a
long
great
day.
update, great update, thank you.
It's nice to
Thank you
have
very
you
much.
at the appearance.
Thank you, Sarah, I appreciate the update here.
The next item is
Don't go anywhere. Okay, so we're moving on to agenda item number 5, which is an approval for a fund transfer for social services to fund the correct budget line agreement with the Sheriff's Crisis Intervention Team. And we have with us Kristen Warner, who is the finance guru, finance manager.
Yes. So this
Social
is money
services.
that is received annually from New York State
Office of Mental Health.
Office of Mental Health. We're trying to be creative with how we can use it. So as we are expecting deputies and officers to be attending CIT, we thought that it would be helpful if we were able to utilize some of this money for backfill and overtime purposes, because it is, again, a 5-day commitment. It's pulling men and women off the road, and what better way to use the money, in our opinion, than helping the sheriff's office with this pot of money. We will be getting it annually, and we would need to use some moving forward. Also with running our own CITs, but the cost of that is minimal, so.
I mean, I'm not sure if you have this information or not, but about how many officers would that amount possibly train? Maybe the sheriff has a better idea.
Well, we do have two pots of money too. So
Okay.
we have the state grant that will allow for $1,500 per officer for the week. So this money will be used to supplement that.
Okay.
For the CIT class we're running in 3 weeks, we have 16 deputies attending.
Okay. Any questions from the committee? Any questions from other legislators, for the public? Okay, so I will make a motion to approve this to audit.
Second?
All in favor?
Aye.
Aye. Thank you.
Thank you. Have a good night.
Thank you.
Thank you.
That's it, right?
Thanks for all the info, Sarah.
Moving on to agenda item number 6, is approval for a budgetary amendment for the health department for the preschool 3 to 5 program. And we have with us Mr. Bill Orr, who is the
How are you?
finance manager for the health
I also
department.
brought Valerie Kurtz, who's the supervisor of the EI pre-K program.
Oh, great.
For
Thank
any
you, Valerie. Nice to
further
meet you.
questions you may have.
Wonderful. Thanks for joining us.
It's a big transfer, that's why.
Yeah, we do. We have a transfer, well, fiscal impact of $325,000 for 2024.
Right.
Did you want to embellish on that?
Yeah, I'll just start out by saying there's a few reasons why we're asking for this additional $800,000 in the school-based program in '24. Firstly, we've encountered an increase in children attending school-based programs. It's an unprecedented amount of an increase. There's 15 children. It went from 91 to 106. We've never experienced an increase like that in the past years. So we've always been increasing the budget, maybe $400,000 or $500,000 to accommodate increases, but this is an increase that's never happened before. And each child in a school-based program costs an average of $44,000 a year. Okay, so add the 15 times the 44,000, that comes out to $660,000 that we're going to need for '24. Secondly, several schools have had rate increases for each child that attends their respective school. These rate changes, they can take back as far as 4 to 5 years. And it's the county's obligation to make good on all these prior year rate increases. That anticipated cost for '24 is $100,000 to $120,000. Thirdly, there's an increase in SEIT rates. SEIT is Special Education Itinerant Services. Those rates are $10 an hour. Where'd they go from what to what?
It's, they went up 11%.
Okay. So, and we were unaware of this rate increase while preparing our '24 budget. This could cost an annual of $240,000 at present levels. This increase was enacted on July 1st, so the result will be in half, or about $120,000 in '24. Also of note, we have the itinerant services expense line. These are services for children in their home, and we'll see an increase in expenses for this new added service I'm going to explain to you, and Valerie can go into a little more. It's nursing services required for our medically fragile children. So services just happened in '24, never happened before. These costs could result in an annual increase of about $240,000 if the need continues. For '24, we're expecting $150,000 to $170,000. But we're not asking for an increase in this line yet, because we're going to try to absorb the cost. Hopefully this account can absorb it. Any questions for me, or Valerie will extend some more information?
So this amount is,
It's huge.
yeah, so we're increasing, we have to take money out of general contingencies of $324,000. This is mandated by the state.
Again, this is out,
We have to pay it.
it's out of our control, totally out of control. We're obligated to pay it.
And you cannot plan for it. It's just, you can do your best to project, but when a kid shows up, family is in need and they show up and they need help, we have to cover the expense.
Yeah, we try to forecast, but it's hard to, when a kid all of a sudden comes to us that's really medical fragile, that needs a nurse 24/7, we have to pay for it.
And medically fragile, is that a new, is this, you said this was a new?
Well, we haven't really used
amount?
nursing before
Nursing.
in early intervention in preschools per se, but lately we've had 1 or 2 children last year, and now we're up to almost 3 possibly this year, 2 definite. And the nurse has to be with him from when we pick him up on the bus. That nurse travels with him on the bus through his 5.5-hour program
Oh
and
my
drops him
gosh.
off. So if the transportation is an hour or 2 hours on the bus, then we have to pay for that nurse until they get back home with their family. So it's been costing a lot of money.
So the nurse goes with the child who's
Yes.
okay.
Seizure disorder and might need suctioning,
Right.
tubes like oxygen.
Yeah, I'm sorry for these families, they have to go through all that. Glad they have the services that they need, but it does cost the county. Does anybody have questions? How are we doing budgeting for next year?
It's up pretty big.
It is.
We'll be ready to see it.
Thank you.
Let's hang on.
Yeah.
Just generally speaking, how many EI cases do you have more year over year over year? Like over the last few years, how much
EI,
have those numbers in? How bad?
EI has probably been slowly increasing to about 10 to 20 children more a year. Preschool, we've been seeing a lot more increasing, which obviously is the 3 to 5 year olds.
Right.
We've seen, right now, going into September, we should have a lull because a lot of them went to kindergarten and we don't. We have 103 kids, or 106 kids now in center base, yeah, and we just got those 3. And we probably have almost 390 children total in that program, which is huge for September. It's usually our low number.
Thank you.
Also to Adenizio.
Thank you. Why is this increase this year? What do you think this is due to?
People say it's because of the follow-through from COVID. You know,
Yes.
these kids were home, they weren't in daycare, parents were working from home, they're in front of their computers, they can't interact with their children. They're saying it could be part of that. I don't know. You know, daycares are full, they're not taking as many kids, they don't have the aides to help out in the classroom, so a lot of that is going on. So I think it's just a domino effect, honestly.
And this is all across, this is not just, obviously, Putnam County.
It's everywhere. Westchester, Dutchess,
Keeps-
Ulster, I talked to them all, Rockland County, they're all seeing the same increase. And, you know, for whatever reason, we are getting more and more severe or medical children. Yeah, with syndromes that I've never heard of.
So I mean, I hear all the time that the birth rate is going down and admission to schools and kindergartens is going down, and yet we have more and more cases of children needing help. It's a little bit frightening to look at the trends. You know?
It is, and we even broke down, even with the school districts, as we're at 40 to 50% of the school districts who have CPSE chair students, 40 to 50% are going to center-based programs. So that's a lot of, that's a huge percentage for a school district. So.
What was the percentage before COVID? I mean, is there
It was probably about 20 to 30.
20 to 30 before COVID, and now it's?
It's 40 to 50%.
Gosh.
Yep.
Thank you.
You're welcome.
Okay, any other questions? Okay, thank you. I appreciate that explanation. So I will make a motion to approve this to the audit committee. Do you have a second?
Second.
All in favor?
Aye.
Thank you.
Thank you.
Thank you.
Thank you.
Appreciate it. Nice to meet you, Krista.
Well, thank you.
Valerie. I think I had Krista before. Okay, so we're moving on to agenda item number 7, which is approval for grant application for the health department. I think we have with us Shanna Siegel. She's our supervising public health educator. Can you maybe go into a little bit of this grant application?
Yes, so I'll give a very brief description of why we needed to apply for this grant and why we have to do it now. In the past, Putnam County has had what was a solid waste coordinator position. Years ago, it was full-time. In most current history, it was a part-time position. The Department of Environmental Conservation through New York State will reimburse for this position, or they will reimburse 50% for this position, but only if it's full-time. And the application window for this grant is from August through the end of October. So we kind of needed to be here, even though this is a position that would be in the 2025 budget. We had to come here today so that we could present to you all to get support to actually submit the application. It is my understanding, and Bill might know more about the application itself, but my understanding is that this is, it's not a competitive application process necessarily. We have to meet certain requirements set forth by the DEC in order to be eligible, but if you meet eligibility, then they will approve the funding of the position.
Correct.
So this will be a full-time position that will be funded, partly funded through this grant.
Yes.
So it could end up being pay for part-time position and we end up with a full-time position, maybe something like that, or?
No, there's
So
no
we
part-time
have to have
position.
we have to have a full-time position to be eligible for the funding. They won't fund
Right.
any partial position, so we.
But it could make up the difference.
It kind of does. It's like if either you pay out of pocket fully as a county
Mm-hmm.
for somebody to do this work part-time, and I can explain why we even need this to begin with.
Yeah.
Or you can have a full-time position and get the 50% reimbursement includes
Fringes.
fringes. So it really is, I think, a generous, share between the DEC and county responsibility. So we have a solid waste management plan that has to be, in order for us to apply for funding through DEC for all different kinds of grant opportunities, we have to keep our solid waste management plan up to date. That is a primary responsibility of this position. So
Yeah.
this position has been vacant since her retirement at the end of
Jane.
at the end of the year, right? So this whole year it's been vacant, so there's kind of savings from that in a way, but that means the work hasn't been done at all. And prior to that, it was COVID, so at the health department, we weren't rewriting a solid waste management plan during a pandemic. So this is definitely something that needs to be revisited. Additionally, the county's solid waste management plan is comprehensive for the entire county. So county government, being the lead on this, really benefits all of the towns and municipalities and enables us to apply for grants because we have that plan in place, rather than every town municipality having their own solid waste management plan and there not being any cohesiveness throughout the county. So that's one aspect of this plan. Other things that we've outlined for you, there's a little table that kind of talks about how this ties into our Climate Smart initiative as a county. And on the additional info piece of that table, you'll see that there's a quote from the Climate Smart reviewer. It's really about our goals as a county to maintain Climate Smart and maybe even achieve higher status rely on implementation of a lot of the ideas in our plans. And one of the key aspects of implementation would have to be done through this solid waste position. So it's construction and demolition materials, that's what was quoted here. But also I know that there are, the task force is working on, I believe this week or next week, we have a composting task force meeting. That ties in very deeply with this. This is, we call it solid waste here because that's what we've done for so long, but it's really a waste reduction and recycling position. Because that's, solid waste was like the history of solid waste management, and now the current and the future is waste reduction.
So I did participate in those focus groups that we had, and it was attended or on the phone conference call with all of the towns and all the supervisors, and we talked about comprehensive plan. I think it's a 10-year comprehensive plan for the, and then it just kind of ended. But this position, is it going to be continued in the health department? Because I know other counties have it in the,
We were told
Do you-
by the county exec that he would like to maintain the health department.
maintain it in the health department as opposed to,
At
because
current-
we're the only,
at
I think we're the only
current time,
county in the state of New York that has it in the health department.
Correct.
Don't quote me on that, but
No, that's right.
most of them are in the Department of Physical Services. Legislator Vanessa
You
Reno.
know, the name escapes me, but who was the full-time person
How long ago?
way back when?
Yeah.
Gordon Maxwell?
That's it. There you go, Gordon Maxwell.
Oh, Gordon Maxwell, okay.
Yes.
I remember.
Yes.
It's been that long since we just had a part-time person. Yeah, this is an important position.
Yeah. Yes, it is.
This position would tie together, I think part of the reason that it might be living in the health department in 2025, at least just to start, is because this person works on their own, like they're basically their own division. And because the health department has been doing a lot of this work over the years, for that continuity will help and continue to support that person. There are people at the health department who have been running our household hazardous waste events for years, so there's a wealth of information there. And also we do the licensing of haulers and
Yes.
everything. So that's kind of, like, that's a sliver of this job. But based on what that next version of the solid waste management plan looks like, which is really supposed to be a strategic plan for the entire county. What are our visions? What are our goals? What do we want to see in terms of waste reduction and environmental health? It will probably determine the future of this position too. So that will include composting, I'm sure, but it might include, it might expand or return to different models of litter patrol. Household hazardous waste now happens twice a year in Fonsdock, but there may be new, different versions of that that happen locally. You know, a theme tonight, and probably a lot of nights when I'm not here, is talking about, you know, what are the drivers of like health and well-being in this county. And so many of those are, they're social determinants, they're transportation, there are our finances, our income stability or instability that contribute to our mental health, our well-being. So, you know, making contribution to ensuring the environmental health of our county through waste reduction, recycling, and other options like composting, and making that accessible to all residents, regardless of geographic location in the county, regardless of income. That's how I see a lot of this position having to be forward-thinking and collaborative, you know, cross-sector.
I spoke to Sustainable Putnam, and they're trying to kick off composting and compost pickup, and they're trying to make people understand the benefits of that. They've done a lot of great work on that, and I think that might be something that this position would possibly look into. And also e-waste. I know a lot of towns currently do e-waste, and how would that fall into this, you know, plan for the county?
Yeah.
I think it's that many people need to really understand.
You've hit of everything on my list. I've like enhanced recycling, including e-waste, exactly. You know, even paint care programs. Like
Yeah.
if we want people to not dispose of things inappropriately or even in a dangerous manner, we have to figure out a way to make it easier for people to do the right thing.
And the refrigerators and appliances can be donated and picked up for Habitat for Humanity or things like that, or resold, or
Yes, they're restoration projects and things
yeah,
like
restoration
that.
projects, right?
Mhm.
Go ahead, let her know. Anesio.
That
I mean, I'm sorry, Nazareno.
that happens all the time. Back a few years ago, when I was a member of the town board in Patterson too, there was really an incentive and an awareness about recycling and the environment and composting, and it all sort of went flat. It really went flat. So I think having this position and having someone that's going to raise the awareness, and even for so many new residents that have moved into Putnam County, who are probably, or safely you could say, oblivious to all that, to raise the awareness is really a good incentive to move this forward and for the environment and for the county at large.
Yeah, thank you. I agree.
Any other questions, comments? Okay, I will make a motion to approve this grant application request from the Health Department. Second? All in favor?
Aye.
Thank you. Moving on to other business. We do not have any other business this evening before us, so I will make a motion to adjourn. Second.
Second.
All in favor?
Aye, thank you.